Well, SuperPATH is, it stands for Supracapsular Percutaneously Assisted Total Hip, and that's a lot of words for essentially describing a way of doing hip replacement in a way that allows us to build the tools and the implants inside the human body without having to build them outside of the body and then put them in, without having to twist it in any unnatural positions. And in order to do that, it really allows you to do it in the most, arguably the most minimally invasive way possible.
Yeah, I went to Dr. Chow for this new SuperPATH technology for my left hip, which had avascular necrosis and associated osteoarthritis. A lot of pain, a lot of problems doing normal everyday things, getting in and out of the car, going upstairs, walking. I had a very heavy limp from walking.
Mr. Huminski had a condition called avascular necrosis or osteonecrosis. Fancy ways of just saying that he had some bone death. Sometimes it happens for unknown reasons. But he's very young, very active, and had this very sudden onset of problems that they were preventing him from really walking and doing his normal stuff. The reason he's so unique is because he had different stages of problems on his right and his left hips. And so one of them was so far gone that we had to provide SuperPATH for him in order to replace the hip. The other hip we're currently trying to save.
After the surgery, which was very smooth, the hospital stay was very short. Next day I was discharged out of the hospital. Pain was very minimal after the operation, and aside from just the general soreness of having a surgery on your hip. But other than that, I was in very little pain, and almost immediately afterwards, a lot of my functions were restored to my left hip, such as getting in and out of the car, going upstairs was easier, limp was virtually eliminated. Right now it is eliminated, and I'm very happy with the outcome of the whole surgical experience with the new SuperPATH technique.